Good morning and welcome. Thank you for joining us today. Today is Monday, November 13th, 2023, and we are here in the Commissioners Conference Room at the Larimer County Administrative Services Building in Fort Collins. We are gathered here today to convene as the Board of Social Services and have a presentation from our Human Services Department. I am Larimer County Commissioner Jody Shag McNally, Chair of the Board of County Commissioners, and I welcome you all here today. Joining me today at our dais, around our conference table, is my colleague, Larimer County Commissioner Kristen Stevens, and my colleague, Larimer County Commissioner John Cafalis. Also at the table is our County Manager, Lorenda Volker. Good morning, Lorenda. And we have several people at the table, but I am not going to attempt to introduce every single one of them, especially for a Monday. So I will turn this over to Heather Hare, our Director of Human Services. Good morning, everyone. Thank you for being here.
Good morning, Commissioners. Thank you for having us. Again, Heather O'Hare, Human Services Director, before you today for our quarterly Board of Social Services meeting. So you have before you a packet of material, all of which was also posted online, so anyone listening has access to it. Before we dive in, any additions to the agenda?
Commissioner Cafalis, I see your hand is raised.
Yes, good morning, everyone. I wonder, can we receive an update on our efforts to deploy human services workers to Wellington?
Sure.
If we have any new information?
Yes, we
Thank
can
you.
add that. And then we did want to add 2 additional quick updates. We wanted to give you an update on the transition of the Options for Long-Term Care program to Foothills Gateway, just a status update of where we're at with that. And then we hosted a national association in our office a couple of weeks ago, so we just wanted to give you that highlight as well. So we should have plenty of time to touch on the Wellington piece as well. All right, so our first agenda item, this is work that we have been doing for 6-7 years now, quite some time, in children, youth, and family, and we wanted to share it with you this morning. We have not shared it with you as a board. Well, I think we gave a status update before, actually, Commissioner Stevens and Commissioner Shattuck McNally, when you moved into your seats. But this was also quite a bit of, there was a lot of discussion on this item for the Child Welfare Interim Committee as well. So we wanted to give you an update and just let you know where this work is at. So I'm actually going to turn it over to Thad. If each of you will just introduce yourselves at the beginning and then dig into the presentation.
Oh, fancy. I'm going to mess that up. I got the clicker. All right, Thad Paul, Division Manager for Child, Youth, and Family. I'll have these guys introduce themselves. You got to turn on, yeah.
Katie Heckman, Deputy Division Manager.
Good morning, Jonathan Anderson. I'm also a Deputy Division Manager.
So I surround myself with people way smarter than me, so they'll do some of the conversation here today. So excited to be here and share a little bit about what we're identifying or calling the Larimer County Decision Aid tool, and the use of that tool and how it's driving better outcomes for families in our community. One thing to highlight that Heather mentioned, this came up in the interim committee. So there was a letter that was written by Office of Respondent Counsel, the parent council, in relation to this tool that is being used both here in Douglas and in Arapahoe County, and feeling like that it has the potential to create biases in the system. And actually, I think you'll see our research shows just the opposite, but we wanted to share that with you today. We actually had an opportunity a few weeks ago to do a presentation with the developers with the tool ORP, Office of Respondent Parent Counsel, Office of Child Representative, as well as the Ombudsman's Office a few weeks ago. And it ended way better than how it felt. A little prickly in the beginning, but at the end it was a very good conversation. I think everybody saw the value. So now that I have control. So we'll briefly go over the high level agenda is talk a little bit about the decision making, like current decision making, historical decision making in child welfare. We'll do a much more in-depth conversation about what the Larimer Decision Aid Tool, or LDAT, is. We'll talk about the research, and then we'll dive into the future. As a level set, the LDAT is a software. So it's a software that overlays and pulls data out of trails to help identify some risks. So we'll get a little more detail, but I wanted to do a high level set on that. And I have my two deputies who have been actively involved. Two of the four deputies have been actively involved in helping to roll this tool out. So got the experts in the room to answer the questions. So a little background, didn't know there was a transition there. We wanted to explore the use of this tool, partly because we'd been in various presentations across the nation and in Colorado on different ways that software tools have been used to look at and help make decisions in assignment for child welfare. So hearing some of those opportunities that existed, we participate in various conversations, and really us along with Douglas kind of led this conversation in Colorado. And we really wanted, two reasons we wanted to do this. The decision, we recognize that families from marginalized populations are routinely overrepresented in the child welfare system. So our belief was this tool might help us be a little more objective in our decision-making on the front end. And then also we recognize that it's a big decision for us to knock on somebody's door. We bring trauma ourselves when we knock on the door. And we also, our job is to make sure children are safe. So there's those two components. Commissioner Kafalis, you have a question?
Not at this time.
Okay, just make it check. So child welfare staff have a daunting job. We have to look at the present. So and I think you've all participated in a red team process, so you know what it looks like now. But we'll talk a little bit about where it used to be, as well as the red team process. But child welfare is required to look at the referral. What's the risk? What is the safety now, and also consider all the past. The past is an indicator of possible future risk, and so those two things both have to be considered when we're making a decision whether we go out on a family. In Colorado, we have the benefit of having, tongue in cheek, we have the benefit of trails, which is a statewide data. So it's a statewide data system. So that's the tongue in cheek is that is actually not all states have a system that the same SACWIS, the same child welfare system, is used across a state. That actually helps us in this tool because we are able to capture much more history when we look at families versus just location by location. Commissioner Stevens.
Yeah,
Commissioner Stevens.
now that I know a lot about trails, or at least I'm trying to, with the problems that you experience with trails, do they affect this process at all? Because I mean, I know that in between the trails mod and the old trails, there's a lot of issues and there's a lot of tickets out there and there's a lot of problems, and so does that hamper your ability to grab data from that system?
Absolutely. Yeah. I mean, in essence, this is a software system that's sits on our own local server so Larimer County controlled server, but it pulls the data from trails to help calculate a risk factor. So when trails goes down, all other systems goes down, as do the work that our workers can do. So what happens oftentimes is workers then base it off of all this institutional knowledge that you have in the back of your brain with the family versus what you can see in trails. That is also the value of this tool that we'll get to, is that it is all the factors that workers are supposed to be paying attention to in trails when we're making a screening decision is actually you're interpreting from your own lens. This tool helps us kind of more objectively interpret what all the information is telling us. Commissioner Kafalis?
Commissioner Kafalis.
Sorry.
Thank you, Madam Chair. I'm wondering, I'm glad that we now have an in-resident expert on the trail system, so that's a good thing. I'm wondering, how does this tool interface with the benefits support side of things, CBMS, for example? Historically, anytime we try to make any updates to CBMS, that becomes a costly endeavor and gets complicated.
Mm-hmm.
And Commissioner, could you explain, I don't, maybe I did, but just for our public, CBMS means?
Oh, my goodness, I used an acronym and I...
And you really call me out.
You called me.
I'm used to being the one.
Good for you. Community benefits or benefit management system?
It's Colorado Benefit Management System.
Colorado Benefit Management
So
System.
kind of the
Thank you.
sister database for the public benefit
Colorado, of
programs.
course.
Yeah. So it is not impacting us now. In the initial stages, when we first developed the tool with the developer, it actually did include the data from CBMS as well as Trails, but we realized that actually that information wasn't changing the risk score. So we, instead of relying on another system that is often up and down and breaking the tool, we kind of separated that tool and now just use the Trails system. Yeah. So high-level overview. As I mentioned before, we were asked to both appropriately assess, intervene appropriately at the right time with the right service or right supports, and while preventing future harm as well as addressing anything that's happening now. So you'll see, I know you all have sat in Red Team. Those are complex situations that you're hearing, that our staff are hearing every day. And there are a whole lot of factors, both strengths and cons, or safety, or some safety, some strengths, and also some risk or some worry or some danger and harm that are associated with all those referrals. And every individual that is sitting in that Red Team is sitting through that process and interpreting that risk from their own life perspective, their own lens. So the beauty for us, and we'll cover a little bit, is obviously our Red Team decision making is a group that's helping to make that decision. Historically, most of those decisions, including here, used to be made by one or two people on whether we would assign or not. And that is very different than what it is now, but that is a historical piece. So it's that historical individual perspective that has had the opportunity and for sure led to some bias into the child welfare system on the screening on the front end basis. We do have an overrepresentation in our community of folks that are referred to us as well, so we can't stop what's being referred necessarily, but we do have our own biases that impact our decisions at screening and as case assignment and opening out-of-home removals if that happens. So we have somewhere in the range about 7,000 referrals every year. That's about 14,000 kids. Some of that is a duplicative kid count because some families have multiple referrals. And we've, as I mentioned, historically, we would have one or two people helping to make a decision whether we went out, whether it met criteria for us to respond. And as you know, we shifted when we, along with 4 other counties, brought DR to Colorado, and so the Red Team process came with that when we started the DR pilot. Differential response. Dang it! I was doing so well. And so, still in many locations across the nation, it's still the screening decisions are still a 1 or 2 person decision. The DR process is very different, and the Red Team process is very different for Colorado. And so that's a huge strength. And then, so when we brought DR, we actually moved our screening rate down from 45% of the referrals that we were getting down to 29%. So in essence, the group decision-making helped us make better decisions on what we should be going out on versus what doesn't need to go out on, and we can access supports through the prevention community. So we have a pretty broad brush of prevention services that happen in our community, including the grant that we're running into our last year of, but also a lot of community partnerships that do a lot of prevention work for us. So all those kind of factored into helping us move from 45 to 29% screen in. Even in a group decision-making, you still have the individual perspective bias that is brought into it. It's just offset because you have multiple lenses in that conversation. And so much of the decisions on what we're worried about in regards to future harm or risk is based on that history. And it's the history in Trails that is super complex, and it's a whole bunch of data and a whole lot of narrative that is all kind of rolled together, and people are telling the story and assessing the risk in their head while they're looking at this tool. And I'm probably stealing some of what Jonathan's going to say because I stole that from him. I'll just say that. And Red Team is a time-intensive process, as you can imagine. 7,000 referrals. Not all of those necessarily go to Red Team historically, but it's a 10 to 15 minutes per Red Team. That's a lot of FTE that are spending in that conversation to make those decisions. So we decided to explore this use of this tool to help aid in the decision-making. This tool does not make the decision for us. I think there are some other locations nationally that actually use a risk score to make the decision for them. That is not who Colorado is, and it's not who Larimer is. This is a piece of the information. It's to help tell a little more objective picture of what the historical risk looks like, but it is not making the decision by itself. We still want the people that have the smarts in the conversation to help us make good decisions for families. So the tool provides a risk score. Jonathan will go into some of this detail. And like I said, it's an objective snapshot of what's in trails. And the score is based on the same information that staff are supposed to be paying attention to when they're making those decisions anyway. So this is something that we're supposed to be doing anyhow. We just now have a software that's pulling in information and giving us a score to say, really pay attention to this one. So I will turn it over to Jonathan for the decision aid tool.
Well, Dad already stole all my talking points. So I'll
Yes.
just stare at you guys awkwardly for the next minute or two. So I'll get to talk a little bit about what this looks like practical day to day for the supervisors and caseworkers. Here you got an actual picture of what the team sees when they pull up the tool on their dashboard. And like Dad talked about, it is a decision aid tool, right? It's not the sole decision maker in the process, but instead it helps to support and really complement what the red team's already doing. Love that you guys already know a lot about red team, but that it's a really well-established process that really was working and has been working really well for us. But what this has done is given us one more piece of information to use in that process to help remove some of that bias and also just make sure that we're having richer, fuller discussions. It's built to predict the removals within 2 years, also known as risk, right? So what we're looking at is a lot of consistent, same data points for children who have similar characteristics that the history and the research suggests that similar child did have a removal in their past. So when you see a score, you're not necessarily seeing a suggestion for removal, but you're showing a case that has characteristics similar to cases that have been removed in the past. So what it does is gives us the ability to really slow down, have better discussions about that information so that we're making better decisions for families. So children who have that high risk score, so if you look at that visual there, what's really nice is it gives you the score and kind of some color coding. So obviously we see that red, we see that it's getting high into that 20. And what that 20 means is that a child is 20 times more likely to be removed in 2 years than a child whose score is very low. So they share characteristics with cases that have been reviewed before that show high indication of risk factors for removal. The current referral is not reflected in the score, so we still get that initial information, and that score doesn't pull in that current. We're still bound by what's called in, by our rules and laws on how we make decisions for that particular referral. But what it does is reviews all that history and gives us a really quick snapshot of that risk. Like I said, we still use the red team, so it doesn't replace our review of history. So the teams still get that information, read the referral, and do a deep dive into the history. And then the score is shared right before the discussion. So after we get a good context of what does this referral say, what does the history say about this family, we then have a score that we can use also to look at that and have that richer, fuller discussion. Typically what we're seeing is that it allows us to send prevention resources. So we're really paying attention to when maybe the current referral doesn't need to be assigned, but we see that higher risk score, you will slow down and think, how do we help this family in different ways? Like, are there other resources we could send to work through that? Each child gets their own individual risk score you see there. So you have the child 2-year-old with a 14 and the child 3 with 13. So it's really nice that you can go through and see the risk for each individual child also in that. And then something we ask for on the tool is just a explanation of the tool so that people can remind themselves daily, what's the purpose of this tool. When we have new workers, supervisors can slow down and also use it as a training tool to understand that risk.
Commissioner Stevens.
Yeah, so 2 children in one family could have different risk scores. What would contribute to that? Like maybe their age and they'd be more likely to be vulnerable, or kind of, is that?
Correct. You're spot on. So it's over 170 different characteristics. So you change one that maybe when they're reviewing past referrals with that particular child, that child might not have been part of that referral because they weren't born yet. So they'd have less referrals on them, and younger ages would make them more vulnerable.
Thank you, that's helpful.
Lorenda.
Thank you. So because you pulled this data from Trails, if they move from county to county within Colorado, you get all of that information that is part of this score, so you're not just looking at your own files, is that correct?
Correct.
And I just want to reiterate one really crucial point that Jonathan shared. So, state regulations are very clear of what meets a threshold for assessment and what does not. This allows us to see that history in different ways. So we may be looking at a referral today that does not meet criteria for us to respond to assign for an assessment, but we see the high risk score. And so I just wanted to reiterate what Jonathan shared. It allows us to identify other resources to help that family when maybe our hands are tied by state regulations today because that referral that we're looking at doesn't meet that criteria. So it helps us to see a fuller picture for that family and then discuss what other resources might be appropriate if we're not able to respond.
Commissioner Gonzalez.
Thank you, Madam Chair. Thank you, colleagues. Question I have at the moment, and I have a couple more at the end. One is regarding this, looking at the characteristics and determining the risk of a child or children being removed within 2 years. Does it provide any information about whether or not, for example, whether or not that if there is an out-of-home placement, whether that's in congregate care or perhaps kinship care, and therefore with the kinship care, I would assume it would need to provide some information about family or support or that kind of thing. Does that make sense?
Let me make sure I understand the question. So does it differentiate the type of placement that a child might had and weight it differently?
Yes, I believe so. I mean, if it's determined that there's a higher risk for out-of-home placement, the type of out-of-home placement, whether or not it would,
Trying to predict
it would
the
be
type.
kinship care perhaps or congregate care. And to me, kinship care implies that there's a support system locally or nearby where a child might be placed.
It factors in the different levels of historical removals, like that is part of the weighting, but it is not looking at the future decision path. It uses the removal marker in 2 years. The reason it uses that is that we put it out that far because in 2 years, that gives us 2 years of opportunity to have prevention opportunities so we don't get to a removal standard. So we're not using the tool to say, yes, we're going to go remove, so let's remove now and figure out. We're using the tool to help us make decisions to avoid that removal. And the removal decision itself is a decision that is shared not just by child welfare. The court is, in essence, the one that can order the custody, and so it's like we've gotten to a point of there's so much safety or risk that we have to do a removal, and that's validated by other systems. So that's why we use that as the marker of the predictor of risk, if that makes sense.
And certainly that makes sense, that there's a 2-year time span to really look at prevention services and other factors. And then ultimately, if indeed it is warranted that that child needs to be elsewhere, out of the home for safety reasons, at that point, we would be discerning kinship care or whatever it might be. That makes sense. Thank you.
Yeah.
So I had a quick question as well. I had made note of what Jonathan has said about the higher risk score, so then they'll just send in more prevention services. So I made note of that. Can you give me an example of what a prevention service might be?
So we have a broad range. So we have multiple contracts with community partners that can go out and offer resources to families that don't qualify for a screen-in, that we can't screen them in based on the referral itself, but community partners can do outreach. We also have our prevention grant that we have from the Children's Bureau that Deb DeLuca's team is currently facilitating. That is for staff that have lived expertise that are out there in the community kind of working with families prior to them coming to our system. And it's also prevention from coming back into our system. Like child welfare, in an ideal world, we put ourselves out of the business and we have all of our resources are on the front end and we're not having any incident that rises to us having to come to our system. But if we touch a family, every intervention that we have is also an opportunity for prevention. They shouldn't have to come back. There shouldn't have to be another incident that drives them back into child welfare. So it's prevention both after we've been involved, but also opportunities to get in front of it so we don't have a future referral.
Sounds great. Thank you.
Other questions? So we'll get to the research. We don't like to jump into anything. We don't like to use anything wholly until we have a good sense on whether it actually helps us make better decisions. And so, and the reason that it's been a really long road for this tool for 5 or 6 years is that we actually did an RCT, a random control trial, and we did it right about the time COVID hit. And so that kind of changed the whole world for a while, obviously, including the volume of referrals. So everything kind of had to get extended just because we needed enough of the observation period to make sure that COVID didn't have different factors on the historical risk and decisions we were making, as well as just the sheer volume of referrals that we had for those early COVID years were significantly less than they had been prior. So we partnered. So Auckland University is in Auckland, and they are the developers of the tool, but we partnered with Princeton and Yale to do the random control trial research for us. They were actually 2 PhD students that are now working in other universities, but we're hanging our hat that it was Princeton and Yale to start, and so and they're very reputable institutions where they moved to. So we wanted to do this RCT. So in essence, what happened is that every referral in the early stages, if you saw the referral would come in, the red team would see the score, and if they saw the score on this family, they would always see that score for every referral in the future on that family. And then for the other 50%, you wouldn't see the score. And so it was a true random control trial, the gold standard in research. And there's a couple of relatively significant findings. So this isn't fully peer published yet, and so we will get this to you once it's a published document, but it's also very similar to the findings that happened in Douglas County, which is already published, that it actually helped, they actually made better decisions on the low end. So as Jonathan was highlighting, you have that little scale, so the 0 to the 20, anything in the middle to the left is lower risk, right? And then anything that's over in the yellow, orange, and reds are the high risk factors. And so what we identified is that on that left screen is the future hospitalization data. So we were able to utilize hospital data across Colorado and look at the population of our kids that we were seeing the score on and either assessing or not assessing, but also seeing the score on. So the left side of the tool is very low. Those are the risk scores, if you will. So 0 to basically 15 is the medium. Or actually, I think it's more like 9 is the medium, and then the very high risk. So basically, at referral, if it was a very high risk, that meant you had a 17 to a 20 on the LDAT score at that referral. So what you'll notice is when we did not see the LDAT, which is the blue bar, versus when we did see the LDAT, the reduction of future hospitalizations of those children, especially on the very high population. All the others are relatively close, but it's that very high population that had a pretty significant reduction. There's a lot of factors that are a little bit unknown about that impact. Are we having different conversations in Red Team that are helping us make better decisions and engaging families differently? Are those more in-depth conversations helping us pay attention to other risk factors that is that physical health stuff that oftentimes doesn't get brought into the trail system? But it was undeniable, and this is a finding that was a little bit shocking to our researchers, as they had not seen this level of impact across other sites. Some other sites do have hospitalization data in their data set, and they did not see the same outcome. Maybe even more significant is the right side. So this is the overrepresentation or the screen-in rates, and so this is for African American or Black children. It is similar for Latino or Hispanic families, although not statistically significant. So we are just showing the statistically significant research findings on this one. And you'll notice, so the light blue are the ones that there was no Black referral, a low-risk referral on Black or African American children that had a low score. So the blue one is the blue is non-Black, so the rest of the population, if we saw the score or did not see the score. So the light blue is we did not see the score. The dark blue is we saw the score. You can see really no differences for the rest of the population. On the light red, next to that is Black or African American children on a low score. When we did not see the score, that is our assignment rate. The dark red is when we did see the score, the reduction of assignment. So that left side of the scale is how likely were we to screen in the referral. The across the bottom shows you the low to the medium and then the different race population. So a significant, like a 50% reduction in screening. We historically screened in more Black children that had low scores when we did not see this tool versus when we saw the tool. And I'm sure that we'll have some questions, so I'll sit with that.
Commissioner Stevens.
Well, I mean, that's obviously good news. I mean, and it shows that it eliminates some of the bias that's there, so that's really good. You know, I mean, it's data informed, and that's what we like to see. Yeah, I mean, I don't know if I have any questions. I just think that that's pretty telling for, I mean, I think that that's good to know that the tool is screening out some of those biases that we all have and don't maybe acknowledge or realize sometimes, so thanks for
Commissioner
showing us that.
Kafalis.
Yeah, thank you. So, you know, one of the questions I had for the end that I think relates to this, and I have something more specific to this slide, and that is, what is the technology behind this decision-making tool? Algorithms, AI, I'd like to better understand that because we're moving into that world. But I'm curious, it seems like, well, what is the methodology or the types of questions that are being asked so that we are actually reducing the bias, you know, in terms of children or families of color? Because I know, for example, when we were looking at the CPAT, the Colorado Pretrial Assessment Tool for Community Corrections that UNC develops, I think the original one, I mean, all of that's been validated, but they did do an update because there were questions in there that perhaps disproportionately impacted, you know, people experiencing homelessness because they didn't have a steady address or maybe access to a phone. So I wonder, what is the methodology? What are the types of questions that are helping us to get these results? What is the sample size perhaps of this research? And maybe at the end, what's the technology behind this?
Yeah. So I don't know, I don't remember the sample size, but it was over 4 years of referrals, so it's
How many?
4 years of referrals, so it's a significant volume of referrals. The tool itself does not kick out a question, right? The tool gives you the score that then generates different conversations in the red team about should we really screen this family in or not? So that's the piece that is a factor. And yes, it uses all that historical information, and it does machine, you know, it takes all that information and develops a score based on what that child looks like as compared to other children that look similar to that, what happened to them. So the tool is actually developed off of millions of pieces of data across the state that it helped to say these are the characteristics that are most likely to lead to future removals. So this child on this referral looks very similar to this other child that in the past had a future removal. So it doesn't create questions, but it generates questions, I guess would be my answer. There.
So this is very striking, very eye-opening. I want to go back to what you said, that for Hispanic or Latinx families, it's not statistically significant, but shows similar trend. Can you expand on that or tell me more?
So it's similar to the bars are much closer on the low risk on Latino or Hispanic population. So there's not nearly as much separation. So it just didn't have enough significance to say it actually made a difference on that population. But it's still we still were screening in more low risk Hispanics than when we saw the tool versus not saw the tool. If that makes sense.
So, is there an opportunity to take all non-white referrals and clump them all together and look at it that way? So like it would be combined Latinx families, Black or African American families, Asian American families, put them all into one group and compare to, has that been
Population.
looked at?
Yeah, we have lots of disparity and overrepresentation reports that are available to us, so which includes at the child population, at the referral rates, at the screen-in rate, at the case open rate. So there's two mechanisms to do that. One is to compare it to the population of what is represented in the community, and then the other one is the baseline, which is as it represented to the white population. Like here's the white is the level 1, and are they up or below what the white population is identified? And so we have disparities reports that we have developed to pay attention to those conversations. As you said, this was this finding is one of those that was a little, I don't know that it was a shock, but it was a good shock for our system, because I think you get in the rhythm of, we make really good decisions as a group, and we still don't make the best decisions for everybody as a group.
But it's really good news that this is showing even maybe across other ethnicities that there's that trend, even though it's not statistically
Yeah.
significant, it still showed maybe a trend. Could you say that this was helping? So I think that's really great news.
Yeah,
And-
it shines a light. right?
Yeah.
It keeps the light shining, I guess, versus shining a light that was already being paid attention to.
bring awareness, I guess, so.
Yeah.
Okay, thank you. Any other questions? Okay, thank you.
What I would suggest is when the research is published and available, we'll put it back on an agenda. We'll give you the report well in advance so you have time to read it. And then we'll get it on one of our future agenda items and dedicate some time to really dig in and look through the research at that point. That'll have the Latinx. It will also have the findings of changes in screen-in or screen-out rates for Caucasian families, so we can really dig in at that point too.
Commissioner Gonzalez.
Thanks, Madam Chair. Thank you, Heather. Prompted a question, what you just said. Will it also include findings for children with special needs or with disabilities?
So it will not, because unfortunately, we do not have the mechanism to track that in trails today. That is one of the items that had a lot of discussion at the interim committee. So maybe we can come back to it when we get to the interim committee update. There is not a way for us to track that information in trails today, which we have raised as an issue. So we can elaborate more on that when we get to one of the bills in particular.
Yeah, that's a piece that Trails doesn't have that, and honestly, Trails is not perfect at the ethnicity or race either, especially at referral. So when a caller is calling in, if we don't have any knowledge of that family, the caller is calling in and identifying a race or ethnicity based on their own lens. So that it's not perfect ethnicity. The value of this research is that they were actually able to use the hospital data to get to the right race, which actually validated our race findings, versus other communities still struggle because the ethnicity that isn't, or races that are in Trails are not expansive, first off, but also they're still many times based on the lens of whoever is calling in, that can obviously very much be skewed. So what's happening next? I need to check time, so we're a couple more in, so we're all right. So obviously the RCT's done. We're seeing the score on every referral. The score happens in all the red teams as part of that discussion process, and so he's helping to inform the decision, as again, not making the decision. And we think there's opportunities to actually broaden how we can maximize what is used, or the data points that are used with the tool into the future. So I'll turn it over to Katie to cover that.
So on this slide, you're seeing a picture of the dashboard for the intake supervision tool that will be coming to Larimer County soon. This dashboard is built upon the same data points that the decision aid tool uses to incorporate some of this information into the supervision tool. So this is the front page of our supervision tool. And I think there's 3 benefits to this tool specifically. There will be an ongoing tool as well that will look a little bit different, but still the same concept. So this tool is going to help with the efficiency for supervisors in supervision, because it helps to get the data at your fingertips. When you're working with a caseworker on accountability or compliance measures of supervision, it really helps a supervisor to see right there in the moment, one, the complexity of the workload, to see kind of how the caseworker is dealing with the compilation of cases on their workload, and 2, the different measures or the different things that they're doing in their case that they need to do timely or have completed in their assessment. Secondly, it allows for an increased effectiveness of supervision, because what we've learned from our Douglas County partners and also from supervisors who are testing this tool currently is that you can get to the accountability and compliance piece of supervision more quickly because the data is there, and then you can move on to that teaching and supportive component of supervision. So you really have the opportunity to have a much more effective supervision session given the availability of this information. The third part, you can see really small in the right-hand corner is a box that says notes. And so this is going to allow us to increase collaboration throughout our department between supervisors. You can take notes in here that can be shared with other supervisors. Say you have a case that comes in on after hours, they can see kind of what is going on in that case, what the next steps are, and they can make sure that we have consistency in the way that we're supervising or working with families.
So the tool pulls that information from Trails and has it at your fingertips, as and maybe you've seen in some of the demonstrations of Trails. There's 27 buttons you have to get to navigate the Trails system. So the beauty of this one is it's all right in front of your face, especially the really important stuff like the why do we get involved? What is the original reasons? What is the support plan or safety plan scores? That stuff is right there in front of you, but also, as Katie said, it's the when was your last face-to-face? When is your next face? It's some of those more accountability measures that we also want to track. So that is right in front of you. So Katie mentioned this complexity score. So it's how we view the complexity score in the ongoing tools. It actually will allow us to make better case assignment decisions to workers to better balance the complexity number, the complexity score that a caseworker might carry. Right now, it's kind of a random, you go through the rotation on the intake and then whoever's next on the list. And sometimes, for whatever reason we've historically found, is that workers that have been around for a while, they kind of collect really hard cases because everybody really believes in that worker. And as you can imagine, hard work on top of hard work on top of hard work leads to turnover and burnout. And so this tool will allow us to make better decisions to keep those things balanced. And there's a research opportunity there on, does that change our turnover rate or retention rate in the future based on the complexities, the balancing of those complexity scores, or is there a certain line in there that actually leads to more burnout or less burnout? So there's some future research opportunities within the use of the tool as well.
Commissioner Gonzalez.
Thank you. Will this tool, from the supervisor's standpoint, help us to identify proactively if there are any discrepancies regarding what caseworkers are supposed to be doing?
I think in the pilot that we've been doing with a couple of supervisors thus far and kind of testing out the tool, because the information is so much more readily available, they can see it all. There's a separate screen to this tool. They can see all of the face-to-faces and attempts and everything and read it right in that one screen. I think it will be a bit more accessible to notice patterns or lack of efforts or things like that. So I think it just makes it more readily available to the eye to identify maybe discrepancies.
And we do have a multitude of other reports in our system to say, here's caseworkers that are having trends on contacts or whatever else the other factors are. So I think and those are monthly reports, and this is in the moment. So that it's kind of getting us on the front end of here's the data now versus let's not wait for the report that's coming next month to see what's happening.
Thank you.
Well, that is it for that. Any other questions? Any other?
Yes.
Stevens.
Thank you. Thank you, Madam Chair. So my question is sort of knowing that there are discrepancies, that there people who live in poverty or have other issues might be more likely to have referrals, and so how does some of this work affect on the prevention end of what you're looking at and resourcing people? Because I think middle class white people have an easy time navigating a system usually. I mean, they have that comfort level. They have the language language skills to be able to do that. They're not potentially working two jobs and things like that. So how does that I mean, we have this data and it's great, and but there's still disparities there, right? I mean, even if we're not referring low level cases as a higher rate, how I know we have the grant. Are there other ways we can do that? Do we? What does that look like to be able to resource people so maybe this doesn't happen in the future?
There's lots of work being done across the department. So we have one of our strategic plan subcommittees is the strategic outreach committee, which is just that. And the grant is actually helping to inform how do we better reach the community, and that subcommittee or that committee that we have formed is actually identifying locations for us to be present and in the community to serve the populations that might need us most. I think a huge lesson learned that we've learned from our grant is the lived experience, how somebody with lived experiences engages the community is so vastly different than how child welfare historically engages family. And so I think it's, as much as anything, it's the lessons that we're learning from those people doing that work on the prevention lens that is helping us to almost translate our experience with families versus this family's experiences with us. Deb DeLuca is supervising that program. She's been a supervisor with the county for, I probably shouldn't say it out loud, 25, 30. I mean, she's with the county for longer than me, and I've been here for a minute. And so she's done a lot of things, and she every day says that program and how those folks are working with the community is changing everything that she used to know about working within child welfare. And so we'll have that opportunity to leverage the folks that are working in our own division and doing that work to share that. How do we engage them? And we have a whole bunch of other projects that how do we continue to identify opportunities to partner with the community. We pay for staff at Matthews House and House Enabling Services to work with families in the community so they never have to be called to us. We're paying for it out of child welfare block dollars just to serve the community so they don't have to come knocking on our door, or somebody doesn't have to make that referral because there's community providers that are out there meeting the need, and it feels much safer for our community to approach a community provider than the government or the Department of Human Services.
I would add to Vanessa and Thad have done a tremendous amount of work to really align our TANF spending, temporary assistance for needy families. We are modifying our community services block grant program. We're hopeful that we might be able to provide in some context general assistance, right? So we are aligning what we can internally in the department to be able to leverage other funding streams to be able to provide those immediate cash assistance resources, knowing that child welfare is still really driven by poverty. And the other piece I would add, the grant that is supporting Deb DeLuca and her team is up this coming year. So Thad's working on a sustainability plan. We have had conversations, the child welfare funding model is before the Joint Budget Committee right now. So we've shared some information with Senator Kirkmeyer, our representative on the Joint Budget Committee. There is a line item in that funding model at the state level for prevention funding. We're really hopeful that that will move forward, but we are at a point where the federal grant will run out in this next September. So we'll have the research from CSU on the impact of that grant. Deb, like Thad said, has shared a lot of how that work is really changing how we engage families, different than how traditional government structures engage families. And we're at a point where we have to figure out the sustainability because we know that it's having a good impact. So we can bring that back to and share that as it continues to move forward here in the next 9 months or so. But our hope is to be able to identify a sustainability plan one way or another to keep that work moving forward.
Let us know how we can help with that. Obviously, if something comes through a joint budget and we need to talk to folks about how important it is to support that, because I think it is, helping people on the end of, there's a despair and when you financially can't make ends meet and you're doing the best that you can. So, how do we alleviate that in our community? I think that's really important to prevent this altogether, right? Many of these situations, if somebody got a little assistance, could get some childcare help or whatever, we could avoid assistance where people feel at that edge. And so happy to help.
Poverty in and of itself is not a reason for child welfare involvement, but it's all those other risk factors that go with that, right? The poverty leads to I'm having to work multiple jobs just to get by, and I'm leaving my child unsupervised for a couple hours that I don't want to make that decision, but that's the decision I have. Or when you're at the stress level is at a level that one incident drives you over the top. And our families, they come to us on their very worst day, and there's a whole lot of days that they're doing really good as a parent. And so that's the basis that we work from. And we also, when we open on families, we partner in maximize TANF benefits, and we're paying for other fiscal hard service goods to support families that are involved in child welfare, because we recognize just getting by is hard enough to pay attention to what else I need to do when I'm just getting by.
I love this sort of self-righteousness that happens when something like that happens, when a child is left alone, and I think, man, lucky those of us who haven't had to deal with a situation where we've had to make that kind of hard decision, but a lot of times it's about putting bread on the table, and that's, I mean, that's something we can, I believe we can figure that out, and I appreciate the work that you're doing to do so. Thanks.
Thank you, Commissioner Stevens. Commissioner Kafalas.
Thanks. So just to go back to what I asked earlier, can you further explain the underlying technology behind this tool, algorithms, AI? And one reason I ask this is because, at least with algorithms, historically there have been some concerns raised, maybe we've addressed it, but the people who write the algorithms, I mean, it's based on their lived experience, and sometimes, at least what I've understood in the past, there can be biases that are part of that algorithm. And it seems like you've provided evidence that it's kind of the opposite. So can you speak to, are we talking about AI, algorithms?
I would say it's an algorithm because it's using math to interpret the data from the past, right? And so that's what an algorithm is that it's using the data points and all those data points. So the tool has 183 different factors that are pulled into it, 77 or so are weighted, but those decisions are not made from the lens of the developer. Those decisions are made based on what the data told them should be the indicator. So they used those, they went back, used millions of cases across the state, and then looked at the ones that had removals and then figured out which were the indicators that led to those removals and used those factors. So yes, it's an algorithm, but it's not, an algorithm is using math to make decisions. And I would also say that actually my staff are an algorithm. They're using their brain to make decisions based on all that data that they know, but they're doing it in their brain, not through the context of the objective data set.
No, that helps me to better understand, but indeed, I appreciate the algorithms and your staffs, your staff is using, but I know them, and there's a level of trust that, based on the relationship, we don't have relationships with these algorithms that are, but I understand it helps me regarding looking at all the different factors in the data and then somehow coming up with some characteristics that we need to pay attention to.
And that's why we had apprehension and why we wanted to do an RCT. We didn't want to step into something that is helping us make bad decisions.
Thank you.
So back to the JBC and some of the conversations, let us know. I want to reiterate, let us know where we can have those conversations. These are great talking points, but if there's some other really strong arguments to make, that would be great to have in our back pockets, because we'll be, the next few weeks, having lots of conversations with lots of different folks. And I think overall, it just makes common sense. Whenever we can be more upstream or more proactive, it's definitely more effective. And so I'm glad to hear about some of this work, and also just loving that we're meeting people where they're at instead of having them come all the way over to other things. Is that happening? I heard a lot of mention of Fort Collins locations where that's happening. Where is that happening in other parts of the county where you're meeting people where they're at? Is this happening in like Angel House or HNS or up in Estes? Sorry, I just have to beat that countywide drum. Are we doing this at other locations?
Yeah, our partnership, as I mentioned, we have the prevention workers that we fund in our house enabling services. So we have just as many there as we do at the Matthews House, so both Loveland and Fort Collins. The Community Outreach Committee is looking at all community opportunities. Red Feather, the library at Red Feather, Estes Park. We have an office in Estes, obviously, but it's a very small office. But there's also some remote communities just in the context of Fort Collins, greater Fort Collins, right? So Wellington, for example. So yes, we recognize that it's not just a Fort Collins centric lens. It is a Larimer County lens and opportunities to do outreach. The Deb DeLuca's program, the prevention program, have staff that actually live in Loveland and serve mostly Loveland families, and they're also bicultural, bilingual staff. And so we're very present and very outreaching of all the opportunities to kind of engage, and there's always more opportunity.
Great. I thought so, but I have to ask that question, so, thank you.
All right.
Lorenda has her hand
I
raised.
do. Just one quick question. So first of all, I want to say, you all are really vulnerable to share this kind of information. You do great work, and it can always be greater. And so this data helps you look at that, and you share that publicly, and I don't think most agencies do that. And I appreciate that you all do and are working for ways to make these improvements. I also appreciate the family first lens, like let's keep the family, let's provide support. But I'm wondering, in 5 years or more, will you circle back and validate these scores and how they affected the children? And if this needs to be tweaked in some way, what's the next step after we do this for a while?
That's a great question and something we should have included. So it's the algorithm it's a tool that informs itself. And so our partners with IT in Auckland actually update the tool on the characteristics. If we see changes over time, they actually go in and change the characteristics that are weighted or not weighted based on what we're seeing in the context. So the tool will never be stagnant. There is always a machine learning, for lack of a better way to say it, that continues to evolve, pay attention to the complexity scores, pay attention to the risk factors, and make those adjustments. Because the reality is what did happen in the context of COVID is our referrals went way down. And now what we're seeing is the high acuity crisis that is happening at the other end. Some of those placement decisions will impact how this tool is informing us in the future because the population, the needs of the population, how we're serving them are changing over time. So that's the beauty of the tool is it will constantly evaluates itself basically, and then it flags, okay, developers, pay attention. Here's something that has shifted based on what we knew of the data in the past. We need to reevaluate whether we continue to use that as a weighted score or not score.
Thank you. Commissioner Kafala.
Commissioner
Kafala.
Thanks, Madam Chair. Just one more question, if you will, prompted by our county manager's question, and that is, to build on what I think I heard, will we be able to do any kind of, quote, longitudinal analysis like we do, for example, with nurse-family partnership? In other words, looking at the use of the tool and the random controlled trials, that's really helpful. But how is the tool helping us to do better assessments and, where kids need to be in the child welfare system or out of the child welfare system? But then 10 years from now, are they, are we able to track that, that we've actually made a difference, that we're not just keeping kids out of the child welfare system, but somehow they're graduating from high school and moving on in their lives? Any thoughts there, colleagues?
I've got lots of dreams on research that sometimes I run into some limitations from, no, I'm just kidding. Data sharing is a challenge, right? And so I think there's so much opportunity just with the scores on this tool, the complexity score, how our data systems intersect with other community partner data systems. In my ideal vision, and I've been having this conversation for a long time with Mark Winoker at CSU with the Social Work Research Center, I believe they could actually be a data warehouse for our community because they are such a high like educational systems are such a high standard that in theory we could potentially get to a place that they can have our de-identified data, and then our community could ask questions through their lens and actually get to really good decisions and cross-intersection points. And I think the state has actually opened the door for that conversation. So there's so much opportunity from research. And the reality is we all know research also takes a little cash to complete. And so there's some challenges from a budgetary constraints perspective as well.
But we're certainly having those conversations. David Aero from the county attorney, Jill, they've been doing a lot of work on data sharing, and we've had the conversations with Dr. Winoker and his team. So we're hopeful that we'll keep moving it forward. Yes,
So just a quick time check, how are we doing?
we're good. So we're going to transition to the legislative update. A couple of updates before we dig into the Child Welfare Interim Committee update in particular, but we have a new legislative analyst starting later this week. So Jill's going to give an overview about him, and we will make sure that you have the opportunity to meet him. But also, so I know that Shane Atkinson has been working with all of you to put together kind of the countywide legislative priorities, and we've provided all of that information to Shane, and my understanding is you've already reviewed it for Human Services. What we've done, just as an update, as you've mentioned, Commissioner Shattuck McNally, about how can we make sure that our local delegates are up to speed and advocating for us as best they can. We've pulled together some additional resource documents to go with those legislative priorities. So the child welfare funding model is one where we have some documents that go into a little bit more detail. And we are hoping that as the countywide legislative priorities goes to them in a full packet, that we will follow up with some additional resource documents and a little bit more detail on those items that we've included in there. So they will have the information, and we'll continue to bring that forward. We'll be before you again in February, but a lot will happen between now and February legislatively. So we'll make sure that you're up to speed as those things evolve quickly. So I'm going to turn it over to Jill to give you an overview to our new employees starting this week, and then we'll go into the interim committee roles in more detail.
Hi, I'm Jill Mosh. I'm a division manager in Human Services. My division is Administration, Communication, and Excellence, and so legislation falls underneath here. Stuart Jenkins is our new legislative analyst, and he actually will start this Thursday, so we're really excited that he's joining us. He recently comes from Healthier Colorado, and he was there about 3 years as a policy manager and also the advocacy manager there. So he recently focused on the organization's policy development and strategy on affordable housing, criminal and juvenile justice reform, healthy eating, and then some physical and behavioral health care issues as well. He spent a lot of his time tracking and analyzing bills as they came through, as well as ballot initiatives and local ordinances as well, so he could keep the organization informed. He comes to us with about 9 years of experience, all in the legislative realm, so we're super excited to have him join the Human Services team.
And Shane was on the selection committee with us when we selected Stuart. So we're already having conversations of how the two can really align and make sure that as Stuart's taking the lead on Human Services legislative items, that he's in constant contact with Shane and making sure that you have all of that information as soon as it's available.
Commissioner Gonzalez.
So I presume that Stuart Jenkins will be working closely with the current person who does legislative policy work, Carrie?
No, sorry. So Carrie left our team the middle of this summer. So this was formerly Carrie's position. And so Stuart will be moving into that role.
Thanks.
Yeah. Sorry, I should have made that clear in the beginning. So we will, you'll have the chance to meet Stuart here very soon. All right. So
Can I, if I might, just real quick, make a suggestion, and maybe I should not make this suggestion, but we do have an opportunity, December 5th. We have a legislative, we're having our legislators come, and maybe he can be in the room so we can introduce him and they can see him face to face and along with the others, and developed some relationships already. So I think, and there will be some students from CSU that are coming to watch. So I think it's a great opportunity for everyone to kind of have those face-to-face connections. So I believe it's downstairs at 12:30. We're coming from a ribbon cutting for the I-25. And I think we have quite a few folks who have RSVP'd from legislators. So I would like to extend, can I do that? Is that okay? I just like,
Shane may have already done that.
okay, well, I just think that would be great to have him there. And I actually know, I think I know Stuart. I've talked to him somewhere, I know several times. So this is good to know someone that has that experience. But I think that would be great to have them there, or him there, and building those, just faces.
Yes.
Faces seeing faces, because this is going to already be, as you can see, it's already a wild ride, and we haven't even started. So the special session's on Friday. So, all right, thank you. Thanks, Lorenda. I'm glad to hear that. So please proceed. Sorry, I just
Thank
thought,
you.
hey, wait, before
No.
I think he should be there, so.
I think that's why we're most excited. He's going to hit the ground running, and there's a lot of work that is sitting and waiting for him. So, so the Child Welfare Interim Committee, we've talked a lot about this over the last 6 months or so. They have concluded their work for the most part. So in their October 25th meeting, they reviewed 10 draft bills. So we talked about that when we were before you in August, and they narrowed it down to 5 of the 10 bills moving forward from the interim committee itself. So we're going to give you a really quick run through of those 5. We've talked about them, but we have the prime sponsors identified here, and a couple of just quick updates on 1 or 2 of them in particular. They are numbered based on the list of 10, so they don't go sequentially from 1 through 5. But we'd also have an overview to the remaining 5, because it's our understanding that the committee is running with 5 collectively, and then individual members of the committee have already identified the remaining 5 as their individual bills to come later in session. So it sounds like all 10 are potentially moving forward in some way. So the first one is Bill 1, the kinship foster care homes. THAD has been instrumental in these conversations and the development of the priorities of this bill. The prime sponsors are Senator Zenzinger, Senator Kirkmeyer, and then Representatives Puglisi and Young. And this is really to expand kinship support. It will expand support to kinship to align with changes happening federally, but also really looking at how we can provide more financial support to kinship caregivers who decide that they don't want to become certified foster parents, and really trying to increase that financial support. If they are safe enough that we can place the child with them, then they are safe enough that we should also be able to provide more financial assistance than we're able to today. So a lot of work happening with Senator Zenzinger to really identify what is that fiscal note and how will the financial support change if this bill ends up passing.
I had a conversation with Senator Zenzinger when she was up at CSU a couple weeks ago, and she was expressing that we would, hopefully our county and our commissioners would be supportive of her bill. So do we know which one of these she's really passionate about?
This one.
This is the one she was talking about? 'Cause
Yes.
I remember mentioning kinship, so this is the one she's really, really wants this one to pass. So, okay, it's good to know, thank you.
And we'd be happy to send you more detail too. We can send it to you. The second one is the Children's Behavioral Health Statewide System of Care. So we've had a lot of conversation about this one. This is a CCI, Colorado Counties, Inc. priority bill that is also moving through as a interim committee bill. So this one, the prime sponsors are Senator Kirkmeyer, Senators Michelson, Janae, and then Representatives Duran and Puglisi. This one has a very significant fiscal note attached to it, and staff from CCI and Weld County just last week were meeting with Michelle Barnes, the interim commissioner for the Behavioral Health Administration, because the majority of the fiscal note estimates came from the BHA. So they were trying to understand why the estimate was so high from the BHA and see if we could identify a plan incrementally over the next couple of years to fund it, but also to implement this. So a lot of work is happening even today on this. And this one, again, provides a full behavioral health system of care for all children, any age, and regardless of whether they have insurance or not. So this is the really broad one. There is a high acuity bill that's also coming as well. So a lot more to come on this one, and a lot of conversations will be had through the CCI steering committee as well, since this is a priority bill. The next one is Bill number 5. This is the high acuity. So this is, there was a lot of work happening with the governor's team. This one really expands strategies for the State Department of Human Services as well as healthcare policy and finance. But this one is really focused on those high acuity youth, making sure that kids aren't staying in hospitals, emergency rooms, that there are treatment placements and services available, so that they're not languishing in the hospital or in county offices. There's been a lot of media attention to this. We've had a lot of discussion about this one as well. And the funding mechanisms for this one are still being worked out. So this identifies that counties will contribute through the child welfare funding for a portion of this. So there's a lot of conversations happening with the Child Welfare Allocation Committee to figure out how that might happen. And then other state funding will go into the mix. And this one is really a 3-year bill, if you will. There are pieces that will happen and funding that needs to be identified for the next 3 years, because the issue is it can't be fixed in 1 year. And it will take us some time to really build up those providers, the placements, the accountability of those placements, making sure that they are accountable through licensing and training and placement standards as they need to be. Then the next one, so Commissioner Kafalis, you asked about children with additional needs. This bill, the accessibility for persons in child welfare matters, started as a very big bill that was trying to tackle really 2 things: language access and making sure that families that were served by the child welfare system had access to all of the processes and all of the services in their native language. And then the second half of the bill, if you will, was looking at expanding resources and services for individuals that meet the ADA or the higher disability threshold. And this bill was narrowed down in the last meeting of the interim committee to look at just the language access, making sure that we are translating all of our documents, all of our processes, that they have access in court processes, if they become court involved, in whatever language is their native language. So a lot of work that would both programmatic changes, but also financial resources will need to be identified to move just the language access work forward. But there is still a lot of conversation around both kids and their caregivers that might have individual needs based on cognitive or physical different abilities. So there is a lot of discussion that another separate bill might be coming. But there are changes that would need to be made to trails first and foremost, so that we are able to identify when that family has that need, and able to then adjust our practice and our resources accordingly. So there will be a lot more conversation to come on that one, and we'll make sure to keep it in our updates as it moves forward. Then the last of the 5 bills concerning measures to enhance child welfare system tools. So this one is really focused on trails and engaging a third-party vendor to evaluate the risk assessment tools and also trails as a system. So there was a lot of conversation throughout the committee process about the risk assessment tool. Is it the right tool for Colorado? Does it help us to continue to assess risk? It is a great tool, and it's a tool that many other states do not have, and it's time to take a look at it. We've been using it for quite some time, and as Thad and our conversation about the decision aid tool, practice has changed, the needs of communities have changed, and so it's time to look at the risk assessment tool in particular and have a third-party vendor come in and evaluate it, modify it as needed, so that we're continuing to move practice forward. And then a lot of work with trails and continuing to look at enhancements to trails that maybe are not in the plan for modification today. So there will be more to come out of this specific to the modernization efforts.
Commissioner Stevens has her hand raised.
Yeah, so will there be funding tied to some of this? Because, I mean, I don't know. I keep asking if the funding that's tied to trails is adequate to do the job as it is. And then you probably know about this proof of concept idea that they're potentially changing even to a new platform for trails, which supposedly simplifies things, but is yet unclear if that's true. And so there's so many sort of adjunct things happening at the same time that the modernization is trying to happen. I guess I wonder if there's, is there funding tied to this?
So this bill, all 5 of these bills have very significant fiscal notes attached to them. Very significant. Thad may remember what the fiscal note for the kinship one is, but the language access bill just itself has a $25 million fiscal note attached. And our estimates actually predicted that counties would need 75 million just to change the language access pieces. So every single one of these bills has a significant fiscal note. We've been asking the same question. And what I would ask, or what I would say to all three of you is, every single one of these bills, if it does not have the funding, we will not be able to meet these outcomes or the expectations that will then become statute. Each of these is significant, and we support the practice change, the system change, right? All 5 of these will have, I think, really positive changes to the system, to Colorado's system for children and families. And counties won't be able to meet those expectations without the financial resources. So that's the case with the trails, but it's the case with all 5 of these. But they do all have fiscal note projections attached to them, and we can send that to you in more detail if you want.
Yeah, that's good. And then I guess just with, if it's a county priority bill, it's only a county priority bill if it comes with the funding. Does that, so I think that we need to have that conversation because everybody likes something that's newer and better and more efficient. Don't get me wrong.
Yeah.
And yet there is sort of a limit as to financially what can be done at the state level and especially what can be done at our level. So I think we need to have realistic conversations about this as we move forward because we just can't expand everything forever. And so what becomes the true priority here? And how do we make it manageable at the both state level? Because it's no good to also introduce a program that is not sustainably funded and has to be cut. So,
Yes.
Okay, thank you.
Commissioner Kafalis.
Thank you. I have 3 questions which I think can be answered quickly. One, regarding the Bill number 7 risk assessment tool, is that what we use to implement differential response practices?
It's part of the differential response model, but everybody gets it, so it's not specific to differential response. But the data from our decision aid tool, our researchers have already looked at its use and in regards to the Colorado Risk Tool, and it actually is a great indicator of the Colorado Risk Assessment as well. So it actually, in theory, has an automated tool. The Colorado Risk Tool is dependent on the manual completion by staff. Like many of the questions that staff have to complete are manual or individual perspective, and so the LDAT actually provides a very similar score on the same line as our Colorado Risk Tool that would create a whole lot of efficiencies, but not specific to DR. It is a
Thank you.
Yeah.
Question number 2, will this new person, Stuart, and your team, Jill, have an opportunity to review and do a preliminary analysis of the bill drafts before our December 5th meeting with the legislators?
For these 5,
Yeah.
sure, we'd be happy to.
Well,
I think we have a lot of it already in great detail, so we can make sure that you have it before then.
And then my 3rd question, thanks. It's related to the upcoming special session.
Yes.
Can you tell us the one bill that has to do with allowing for the one proposed bill for administrative changes that would allow us to draw down federal funds, something to do with electronic benefit transfer cards for summer nutrition programs, so maybe 300,000 more kids get access to food. Do you know much about that?
A little bit, probably just enough to be dangerous at this point. So that one, so it will definitely impact our work locally as more kids could potentially become eligible for those food resources over the summer. But the work right now rests with the State Department because they need to make a change at the state level in their food assistance plan with federal partners. So they are doing a lot of that work, and then there are changes that will have to be made in the Colorado Benefits Management System. So there's work that needs to happen at the state level first before then it's implemented at the counties. But I have not looked at that in a couple of months, so we can do that before the 5th as well.
Yeah, and it is my understanding, and it's probably the same thing, enough to be dangerous, but in the executive order that the governor put out, I think to do those administrative changes at the state level, there might need to be some kind of statutory change. Well, they're suggesting there might be a bill, and that's all.
Okay.
Thank you.
We'll look into that one a little bit more closely. Anything else on, so we've just listed the other 5 here so that you're aware of them if they end up moving forward. And if they do move forward, we will put them on into our normal tracking process throughout session so that you're aware of them in more detail. Any questions, additional questions on legislation?
No.
All right, so we have our department activity report is always a part of the agenda. But what I'd like to do now is actually tackle the couple of additional agenda items that we mentioned at the beginning. And then we can come back to the department activity report if time allows. So I've asked, so we've had a lot of conversations on the transition for the options for long-term care program. From our department being county administered to Foothills Gateway. And there's been a lot of work happening to transition both the clients, but also make sure that our staff have what they need as they explore future employment opportunities. So I've asked Lori to give you a quick update on where that's at, both from the client and the staff perspective, just so you're aware as it moves forward.
Sure. Good morning. I'm Lori Metz, Division Manager, Aging and Adult Services. I just first want to make sure everybody has this document here. Wonderful. So I'm not going to go through this high-level timeline with you all line by line. A lot of it you're already aware of. But, you know, back in August, we, with your support, did file for a formal protest to the Department of Healthcare Policy and Financing regarding their decision of the award. We did find out in August that the Department of Healthcare Policy and Financing did decide to upheld their decision regarding that case management agency contract to Foothills Gateway here in Larimer County, or Region 10. You might be hearing it in those terms more so at this point. So at that point, Heather and I had the opportunity to work with the Economic and Workforce Development staff. Mark Johnston, now the director, and his team met with us to come up with some ideas about how we could collaborate and support these approximately 30 staff during this time of this workforce reduction. So those were some initial meetings at the end of the summer. We also took the opportunity to meet with Human Resources, our generalist in particular, about what benefits would be available to staff, how we could communicate those benefits to them, and just make those resources available. Also, when we were notified of the award to Foothills Gateway, we were also notified at that time that we were placed in what's called Cohort 3 for the transition, which was a timeline of April 1st through June 30th of 2024. Once that award decision was made, we did start losing staff, as would be naturally assumed, correct? And Heather had the opportunity to meet with the executive leadership at Healthcare Policy and Financing at the state level to request that we be moved to Cohort 2, which is November 1st to February 29th of 2024, just so that we can ensure that you know, as we move along and staff begin to find other opportunities, that our clients in the community can be served quickly and with more efficiency. They did agree to move us to that cohort. So that is an update that I wasn't sure if the board and county leadership was aware of, that we have now been moved up to this earlier cohort. So with that being said, I attended the first of the transition meetings that the State Department is holding for all regions that are part of Cohort 2 just last week. So these are weekly meetings for the next 14 weeks with the State Department and all of us that are transitioning from November 1st to the end of February. Just to talk about a lot of different details. A lot of it's very technical on the backside when it comes to data sharing and things like that, and transitioning those pieces. Once that decision was made to move us to Cohort 2, Heather and I had the opportunity to meet with leadership at Foothills Gateway as well. They are, in short, interested in engaging with our staff to talk about the opportunities at their agency moving forward. So that was good news. We also, back in September, I discussed with the managers of this program that we do have contracted clinicians on staff that work with a lot of child welfare staff to do debrief sessions when they've maybe had something happen on a case that's been challenging. And the managers actually took that back to those case managers to do a group debrief session for them, and they've are very interested in the idea. So that's actually happening later this month, is that Andrea Holt, who's a licensed clinician here in the community, is going to come and do a session with those staff members. Because as you all can only imagine, everything's okay for a while, and then new pieces of information come out, and, the anxiety and the questions and the uncertainty kind of arise again. So, and the other pieces I just want to highlight is that the economic and workforce development staff have been absolutely incredible. That collaboration has been something that I was not expecting or anticipating to be going so smoothly. They have assigned an employment specialist to this team in particular, who we have now connected with the Human Resources Department at Foothills Gateway. So those two people are working together directly without any interaction from leadership on either side, which has been a great collaboration. They're actually going to do a virtual job fair shortly after Thanksgiving for these staff people to come to ask questions, things like that. We've shared a lot of information with the Foothills Gateway Human Resources Department, what our training schedule looks like, different job descriptions, including salary, benefits, all of those kinds of things on that side of piece. So that's been great. That economic and workforce development employment specialist has been coming to the staff meetings for options for long-term care to just tell them all the resources that they can help them with. Help building their resume if they haven't interviewed in a long time, because that's, you can get rusty pretty quickly if you haven't interviewed in a while. So that's been great too. The other piece that's happening in the what's next piece is that the benefits team and human resources are doing open door sessions 4 times this month with staff to talk about benefits and what that workforce reduction policy looks like, including the severance package and what benefits will look like on that side of things. So, it's not been easy. It's been pretty difficult, but I would say that I've been pleasantly surprised on, just kind of the resources that were available to us just here internally and how open everybody has been to step up on that side of things. So we have lost a manager and 7 case managers since we've met with you all in August in this program. So that's where we stand right now. Do you want to touch on Sure.
Commissioner Cavallis has a question
Yes,
first.
go ahead.
Thanks. Thank you, Lori. 2 questions. One is, I think we're talking about 30 jobs, 30 positions approximately. Do those folks, and maybe you touched on this, do those folks have any potential opportunities to continue working with the county in a different kind of position? That's my first question. And then my second question is, do you feel like it would be helpful if there was some kind of a statement from the commissioners or a letter or some presence to just say thank you to these folks, coming from the commissioners?
So to answer your first question, Commissioner Cavallis, yes. So we actually have had some folks that have taken jobs within Human Services, within the Office on Aging, actually, within the Benefits and Community Support Division. So we've actually been able to keep some of those folks within Human Services. Another piece of what that employment specialist is doing is keeping them updated on what internal opportunities within the county might be relevant to their experience. When you do a certain job for a while, you think that's what you're good at and that's what you can do. But there's a lot of transferable skills, particularly for somebody who's done case management for a long time.
And do you think it would be helpful to receive some kind of an intentional expression of gratitude from the commissioners to folks?
I do. I think that would be,
We should think about that.
I think so now that we have kind of everything in place that we can to support them through this transition, I think that's our next focus is,
Right.
okay, whoever is still in this role come February, they will be laid off. They know that. We've been very open and honest with them. And now we're thinking about, okay, what does that celebration look like? How do we make sure to share our gratitude with them of the fantastic work they've done, some of them for many, many years. So we'll discuss that more, and then we can update you and let you know what that looks like, what we're thinking about. It'll likely be middle to end of February.
Another piece I'd like to touch on is, so clients here in Larimer County that are still being served by Options for Long-Term Care have been notified by the State Department of Healthcare Policy and Financing that they will be transitioning to Foothills Gateway beginning March 1st. We're having some internal conversations here about what that looks like, because the phone is not going to stop ringing here on February 29th. So how we can best serve those individuals as we kind of tease out those first couple of months about people reaching out to us. We've been able to provide some talking points and resources for the Welcome Center staff as people come in, because they get the letter, they don't know what it means, they don't know who they should be calling or when they should be anticipating the transition. So we'll be working on that piece. My hope is that during some of these transition meetings with the State Department and some of our ongoing meetings with Foothills Gateway, we can do a joint letter together out to our clients in the community and some of those community partners that we work with as well, that are used to coming to the county for one set of waivers and services and Foothills Gateway for the other.
So that's where my question is. I'm very curious about the joint letter, so Foothills Gateway is willing to do a joint letter. So how is the messaging going so far? Because this isn't something that we were doing wrong. I take away it's just this process. So how is that messaging going already? Because it has appeared in some group discussions I've been in, which I, fortunately wasn't put on the spot to answer, but wondering how that's going, because it can be kind of confusing, like, is there something wrong? Why is this being switched? And so I'm curious about that.
The message, the letter was a form letter from the State Department that went out statewide to any individual who was changing case management agencies. So it explained a little bit about the case management redesign that's been going on here in Colorado for over 10 years, and that as part of that process, that there was a competitive bid for Region 10 here in Larimer County, and that Foothills Gateway was selected. So there's not a lot of information. Case managers were receiving phone calls with questions about why, and things like that. So, yeah, we're doing our best to share the information as we have it, and directing people back to the same place on the State Department website should they have any additional questions or concerns.
Okay, thank you.
Of course.
Any other questions on that?
Commissioner Gonzalez.
Just thank you, Lori, and of course, I'm glad that you talked about how we are reaching out to the people we serve to make sure they're understanding as best as anyone can these changes and why.
Yeah, thank you for doing some tremendous work in a really challenging, difficult situation. This is just for the public's interest. This is not what we wanted. That's why we appealed, and I'm still not quite understanding how we're here. But we'll make the best of it and make sure the people that we serve are taken care of. So thank you.
Yes, of course. All right, thank you. So why don't let's touch on the update for having staff co-located in Wellington, and then we can come back to the APHSA update. So Commissioner Gonzalez, you asked for an update about our efforts to have more access and staff located in different areas of Wellington. So we have, Thad mentioned it in his presentation, we have one of our 4 strategic planning committees is working on community access and outreach countywide. So we've talked quite a bit about this, but it's been several months. This group is led by Deb DeLuca, who also oversees our prevention team, and then Sarah Roten, who is one of Vanessa's deputy division managers. And they have a group of staff from all of the programs, all of the divisions. So it's a really good mix of staff from across the department that's looking at where can we increase access to our programs and resources in areas of the county where we might have a community partner who has a location, or we might not. So they've been doing a lot of work, and now they're at the point, so they're finalizing their recommendations that will come back to our leadership team to say, here's how we can start to pilot this in the beginning of 2024. Wellington is an area where, under the prevention team, we have expanded services. So the federal prevention grant was focused on 2 zip codes initially, and we expanded as we were seeing the need from across the county grow. We worked and the feds approved an expansion of that grant for us. So we do have some of that work happening in Wellington. We have been working with the community group in Wellington that is hoping to build a community life center of sorts in Wellington. We've had a lot of conversations with them and let them know that if that comes to fruition, we would love to have staff located there. We partner with PSD early childhood professionals as they've been really expanding early childhood care in Wellington. As that community grows, Poudre School District has made a lot of changes in their early childhood programming there, as they've also opened up the new middle school and high school. So Wellington is certainly an area that we have heard loud and clear from the community. They want a greater presence. We have fantastic partnerships with the senior center. So we know that that is a place where we would love to have staff more available there, but also just a greater access to all of our programs. And then, so the team is looking at how do we shift our business processes to be able to have staff co-located in different community partner locations. So the example I often use is how might we be able to have a community support specialist at the food bank that's able to help people sign up and complete the application for food assistance right there at the food bank, rather than having kind of a multi-step process for them to get to us. There will be a lot of business processes that will require. So they're working through that, what that might look like. They're also looking at areas of the county where we may not have a community partner at all. So Red Feather often comes up. We have great community partners in Red Feather, but they don't have the space in their offices where we might be able to come and co-locate. We have a lot of conversations with Estes partners and looking at potentially starting an Estes with our pilot. We have been meeting, I've had some conversations with EVIX, the early childhood organization in Estes Park. We have partnerships with the senior center. So that might be an area where instead of identifying office space or a community partner that we go and house with, it might have more of a mobile approach where, a couple days a week, we let the community know we're coming, here's where we'll be, here's what you can access. Again, to expand that access and that outreach to our services so that people aren't having to come into our offices to be able to get those services. So we're at a point where the group is finalizing their recommendations. They've identified some of the business processes that will need to change. And then we're hoping to start piloting this early in the spring and see what we learned from it and see how we can expand even further. So I'll pause there and see what questions.
Commissioner Gonzalez.
Yes, thank you. And I thank you for the update, Heather. I think that's great news. May I speak with you offline, because I'd like to extend an invitation, if it makes sense to you and/or the appropriate staff, to come to our next Wellington Community Conversation on December 7th, 7:30 to 9 at the famous T-Bar Inn. And I'd like to share with you the context for that and see if that's something that you all might be able to do.
Sure.
And then I have some thoughts on potential opportunities up in the Red Feather Lakes area regarding what you just shared. Thank you very much.
Thank you.
So, we don't mention Berthoud, and, there's opportunities, a lot of older adults up there, or not up there in Berthoud. And we know there's outreach for food insecurity for youth. So I'm just curious also that I never hear much about Berthoud, then I hear from Berthoud that we ignore them. And so I just want to make sure they're on the radar. And I know I've talked to some folks in Wellington too. There's confusion about, I think we gave some funding but maybe potentially gave some funding to a nonprofit that was building or expanding and they haven't done that yet. Curious about the Wellington one. Do we know if that church or nonprofit got their expansion rolling, or what does that look like? And then for Berthoud, because we had that outreach for older adults
before the fire station expanded so much. And so I'm just curious how we're kind of trying to expand that. I know the library has been a great partner there, but, that's not a big space, so.
The library, and I know Grace Place as well as another partner
Okay.
in Berthoud. But so a big piece, and the reason we've called this work community access and outreach is that there is a whole outreach and communication plan that needs to come along with this of what are we doing, why are we doing it, and be able to then have more in-depth conversation with those communities to say, we're happy to come to you. What would that look like? Do you want us to come? So we haven't, to my knowledge, I don't know that we've identified a specific location in Berthoud, but they are absolutely on the list. We did a lot of community convenings with some focus groups across the county to hear from different communities of what do they want, what would it look like, and then they've built that into the process with some of the recommendations. So Berthoud is definitely on the list, but we don't have details of we want to hear from them too of what would be helpful, what do they want it to look like. So that's part of the next, after we have the recommendations and we know what the plan is going to look like to start to pilot it, then we can start to have more in-depth conversations with those additional communities.
Okay, great. I'm glad to hear that. Thank you.
Right, so we will definitely be bringing that back for sure as we start to pilot, and we will share with you what we're learning and how it's going. So just as I mentioned, we have been engaging quite a bit with the American Public Human Services Association, APHSA. We've shared with you over the last couple of years a lot of the work we've been doing around our equity, diversity, inclusion, and belonging work, and an organizational assessment that they built for Colorado counties. We've been working with them in a lot of different spaces and really engaged with them as a national organization that has fantastic technical assistance resources, leadership capacity resources. So we've engaged with them and tried to expand our partnership significantly. And we just wanted to highlight 2 weeks ago, we had the opportunity. So from that association, they have kind of an offshoot for state supervised, county administered locations across the country, and they offer additional resources and support to local human services departments that are administered at the county level. They call it their local council. And so we have the opportunity to actually host the local council at 1501 Blue Spruce. Now that it's renovated and looks beautiful, we are planning on an open house after the holidays so that you're able to come and see it and other community partners can come see it. But we had about 25 county directors, so some of my peers across the country that came, spent time here in Fort Collins. They loved Fort Collins, had great things to say about it, but then they spent almost 2 full days with us at Blue Spruce, where we had the opportunity to highlight what we've done with employee well-being, recruitment, retention, and a lot of the work that we've been able to implement and pilot over the last couple of years. And then the opportunity to hear from APHSA about just some of the work that they're doing in different spaces, new frameworks, new technical assistance, heard a lot about federal updates. So it's a great resource. We utilize them a lot, and they were excited to come and had many county directors come. I think there were 8 states total represented. So just wanted to highlight that here and share that it was a great time, and it was the opportunity really to highlight some of the success we've seen, but also hear from others that we're all struggling and working through similar challenges, even though we may be in very different locations. So just wanted to provide that quick update to you this morning. And then we have our department activity report. So just a really quick, there's really just 2 quick updates that I wanted to provide to you from this, but you have the full report. One piece, we are working on exploring a way to move this from a static report that we provide to you quarterly into more of a dashboard format that will be available. It won't be real time because the data is not available to us in real time, but just changing it from this hard copy document to having something that lives in a dashboard that's more accessible. And then exploring ways that we might be able to have it as a public facing dashboard. This is a public report, so everything that is before you that we provide quarterly is already provided to the public in our documents. So just looking at a new way to enhance and automate the information. And then as we continue to identify data sharing opportunities, how can we tie this into other dashboards, other data elements that are available in other places? So just wanted to provide that update. I know that's been a question from you all in the past, and we hope to be able to give you that update here very soon in the future.
Commissioner Kafalis.
Thanks, thank you. What would be helpful to me, and I believe all of us, would be if there can be information, I'm not sure how it would be presented, regarding any changes we're seeing in program activity, number of folks we're serving, I mean, all the work that all the wonderful departments, divisions do, but what are some thoughts on why that's occurring? If we're seeing, you know, for example, we generate at the top of the list regarding out-of-home placements. You know, are there some new trends or some new factors that we're seeing that might help inform, you know, why these things are happening? You know, good, and I think it's mostly good, but if there are things that are going in the other direction.
Sure. So our initial thought is to take this report as it is today and put it into a dashboard format. So a lot of those pieces are included in this report today. But if you feel like there are some that are missing, certainly let me know and we can identify that. But so we wouldn't necessarily change what's here. We want to provide all of this and continue to provide it quarterly, but be able to do it, potentially even update it monthly. So that even between our Board of Social Services meetings, the information is there and it's available if the public wants to dig in and understand it in the interim. So we're looking at the feasibility of being able to do that. When is the data available? How do we pull it? All of those logistics. So we'll keep you updated.
Yeah, that's great. And just as a quick example that hopefully would help inform our conversation, looking at the you know, benefits and community support division, child support collected, you know, in the third quarter of 2023, there was a bit of a drop in what we collected. So I think it would be helpful to know why, at least our understanding of why, or if we're giving more or less food assistance. Is that because folks are getting jobs and, you know, making more money, you know, those kinds of things?
So the child support, I think we need to look, let me touch on that first and then I'll.
And I wouldn't expect you to answer that today, but I just offered that as an example of that kind of information I think would be useful, although I'm not sure the most effective way to present that as part of a community dashboard, or would that be in our discussions when we're here?
So I think a lot of that context is what I was envisioning having be part of the discussion so we'll still keep it on the agenda, even if it's a dashboard, so that we can be able to answer those questions, dig into any one of the measures in particular, if you have interest. The piece and child support made me think of this. We have significant, there are changes in many of our programs that have not rebounded back to what we would say pre-COVID. Child support is one of those because there were stimulus funds that we were required to recoup. So some of the programs have not yet stabilized. And I say that because we need to figure out what's the best way to still be able to provide that information to you, reflecting back maybe as many as 5 years ago. With child support, it's one of those programs where we need to go back almost 5 years to see what did our collections look like pre-COVID, because there was so much up and down with the collections during COVID. So how we do that on a dashboard versus how we maybe provide you status reports outside of the dashboard, those are the logistics that we need to think about. So,
Quick question. So, last year is when they reduced the food benefits.
yes.
And so, that was about May, so I see a really big drop from Q3 down to this year, which is, looks like it's evened out. So is that Q3 of 2022, is that the last quarter of those all good benefits, or what?
So
what
the
is that show?
the maximum amount of food assistance ended in March of '23. So at the end of the first quarter this year. So on this, in third quarter of 2022, we were still issuing max allotment to families. That ended in the first quarter of '23, and what we still see is a significant increase in food assistance caseloads. We are seeing the highest food assistance caseloads we have ever had in history. And so we didn't see, and this is the caseload, this one I think shows a better representation of what's happening with food assistance than the financial benefits issued.
This one? Okay.
Because we're still seeing really high caseloads in food assistance, even after we expected we might see a little bit of a decrease with the issuance of benefits. So the caseload and the benefit itself, the financial benefit, they are good. They both tell us something different about the program, but this is the most impactful because we're still over 17,500 cases for food assistance. And it's dropped a little bit from the second quarter of '23, but not enough to be significant. And so we're just continuing to see an increase. We also know that prior to COVID, a very large majority of our community were not enrolled, even though they were eligible. So we know that the increase is partly due to outreach and enrollment specialists being at the food bank. We've done a lot as a community to make sure that those that are eligible.
That's where I'm coming from. You know, all of these things that you show us, I'd like to know why. And we can ask that question, like Commissioner Shattuck McNally,
Yeah.
I think, was asking. But it's part of the presentation or somewhere incorporated in these dashboards. If Vanessa's talking about this, and this is why this is happening, this is what we think, why it's happening.
Yes.
Multiple factors.
Yes, so this will still be an agenda item, but we're hoping to have it in a dashboard so that it's available between meetings too. But yes, that context, there's a lot of information in this report, and so that context is really important.
Okay, thank you.
What I would say though is, even with our benefits and community support programs being very high, food assistance being the highest, this is the first time that I can recall in my time with Larimer County where staff are not having to do mandatory overtime because they are actually processing the work in the month that it's due. Vanessa has done a lot with her team and a lot of process changes and tremendous leadership to be able to handle this volume, even within the existing resources we have. So they're doing really, really well to be able to work through this and get people their food assistance as quick as we can.
Wow, that's great. Thank you, Vanessa. Great job. Thank you.
This is the last piece that I wanted to touch on today. So this used to come to you in a separate report to your consent agenda to sign. It will still be coming to consent, but we've added it here just so it's another piece of the department activity report. So these are all of the expenditures in high-level categories that are provided through our department. So food assistance is always the most significant, but $16 million just in, over $16 million just in one quarter of benefits issued continues to be very high. So you will see this on the consent agenda for your signature next week. All right, so that was our agenda for today. But I don't know if there's any additional questions on the department activity report, or anything else that you wanted to discuss before we wrap up?
Commissioner Cafalis.
Thank you. I have one quick question or observation, and just to say thank you to all of you folks. And you have all these really smart people here, and glad we got to hear at least from some of them. But we know that you're doing good work. You know, one thing, going back to the legislative stuff, Heather and colleagues, I'm reminded that on the special session, I think another bill that's going to be considered is maybe a one-time increase to the EIT, Earned Income Tax Credit. So it would be good if our folks could take a look at that. Again, I don't know the details. I think on the 16th, which is coming up, there's a CCI meeting, and I'm sure Shane is doing his best to figure out bill drafts and all of that. But I think that was one of the things that I saw in the long list that will be considered, EITC expansion. I assume that's the state.
Heather, I did share the executive order with you, so the last page has the list of potential tasks.
Yeah.
Perfect, thank you.
So I just want to thank you all for your tremendous work. I mean, it's really interesting to hear about the innovative things you're doing with the research and the results. It's pretty stunning and striking, the results. And again, thank you, Vanessa, and your team for tremendous work for getting, those processed in a month and getting people benefits as quick as possible. And we didn't get to hear from everybody, but I know, Heather, you really have been promoting this team approach and everyone working together, so I really appreciate everyone being here together. And it's great information, and I'm sure as I go through and look through this again, I might have questions, but sometimes I ended up putting them on a parking lot that I sometime get back to. So, but I just want to thank you all for being here today and the tremendous work. This is really the big part of what we do as counties, and it's really important. These are some of our most vulnerable people in our community, and it's really important work. So I just want to say tremendous work. Thank you all. You have my heart for gratitude. Lorena, do you have anything you want to add?
Oh, ditto. Great job.
Okay, so at 11:56, we are adjourned, and I wish you all a fantastic week. Thank you.
Thank you.